A very warm welcome to all of you on this board and on this platform where we are here to tell you a lot about infertility and how does infertility affect men and women both. So we Indians, we are very fond of playing a blame game, and we play this blame game by putting it all on a female partner. I am Dr. Leena Yadav and I am the Unit Head Fertility and IVF of Miracles Healthcare, and I am here to tell you that first of all, infertility is not a taboo. If you are not able to conceive, that does not mean that you are into a very big problem and life ends here. We are here to make you understand that your journey starts here, and it is all about men and women both. So we are here to tell you that if you are facing any issues having a child, if you are married more than 1 year or more than 2 years and you are having an uninterrupted intercourse, that means you are not using any contraceptives, whether barrier or whether contraceptive pills or injectables, and still you are not able to conceive, that means you are supposed to visit a fertility specialist. There are many people who don't understand that. They say that, ma'am, what is the need for us to come to you so early? It's just 2 years. It's just 3 years. I understand that we all are apprehensive to the fact that we don't want us to be labeled into the category of being infertile or some fertile. The only issue is that when you visit us and try to come and discuss your issues with us, we are here to analyze, we are here to test you, we are here to do evaluations for you and give you a proper roadmap as to what is going wrong and how can you solve it. Many a times we don't need any kind of aggressive treatments, and it's just that the timing is going wrong. It's just that there is a lot of stress in life and the men and women are not able to do things at the right time. So we will be helping you with all those guidelines in a very supportive manner and take it forward from there. I am here to make you understand that there are multiple reasons that a couple cannot conceive. But it is for you to understand that every time the reason is not with a single partner. It can be a male factor infertility, it can be a female factor infertility, and also it can be on both the sides. Or maybe at times it is an unexplained infertility where probably there is no reason, but then also the couple is not able to conceive. I would like to tell you that age plays a very important role in the life of a woman, because a woman is born with a fixed number of eggs. So obviously males have always been blessed and they have a sperm which is being generated every 120 days, and then there is no fixed number. But with females, the day a female is born, it is from that day onwards that her eggs started getting depleted. So when the eggs are depleted, that means by the time a female plans to get married, almost 25 to 30% of the eggs have finished. And above all, after that, when we females in today's professional life, in today's life when we want to build up a career, we want to build up a profession, are planning a late marriage and above all a late childbearing, that means another 20 to 30% of the egg reserve is also depleted by the time we consider that we have to produce a baby. So it is for all of you to understand that let's respect first of all that God has given us that we are a female and we have got the privilege of childbearing. Believe me, all you guys, childbearing is the most wonderful thing which can happen in the life of a woman and in the life of a couple. So let's meet each other very soon and discuss with each other and understand as to what are the reasons that why we are not able to conceive. I would like to elaborate some reasons for you. So let me start first with lifestyle. If at all, after 1 or 2 years of marriage, you feel that you are not able to conceive, the first and the foremost thing which you should do before meeting any doctor is get some lifestyle changes. Now, what do I mean for lifestyle changes? How lifestyle can be changed for a man and how lifestyle can be changed for a female. So first, my advice would be to all the males. Please, please, please. The first foremost step which you should do to analyze yourself is get a semen analysis done. Now this semen analysis is done at an abstinence of 3 to 4 days from your partner, and you can get it done from any IVF unit. Once you get your semen analysis and you feel if everything is normal in that, then we go to the next step. Now, if there is any problem in the semen, for that matter, if there is a problem with the count, or there is problem with the motility, or there is problem with the morphology or the physical makeup of the sperm, then you have to consult your doctor. And above all, the most foremost thing is do some lifestyle changes. So by lifestyle changes, I mean alcohol. If you are a person who's taking alcohol regularly, taking 3 to 4 glasses of alcohol a day, please, you got to restrict it. Second, smoking. If you are a person who's very fond of smoking and taking cigarettes, even 1 cigarette a day would spoil your sperm big time. So you have to minimize, or I would say quit smoking if at all there is a problem in childbearing. The third most foremost thing which I have seen in young people these days, young boys, use of drugs. Use of drugs, cocaine, marijuana. People call it a lifestyle these days. Yes, indeed, it makes you happy. It gives you a very good feeling, but it spoils your sperm to a very big. The DNA is gone, the count is gone, there is problem with the morphology, and there are changes where you can also get genetic abnormalities if you go ahead with those sperms in your child. A well-balanced diet. We are very fond of eating junk food these days, and it's a style statement if we go out and eat. But I would really recommend, and this is a recommendation for even the female partner, that a well-balanced diet is very important for both the partners if at all there is a problem with childbearing. You know your diagnosis, whether you have PCO or whether you have calcium deficiency or whether you have iron deficiency. But if you are taking a well-balanced diet, nothing might go wrong. Next is exercise. People don't want to exercise these days. They go to gyms, they make up their muscles, and but actually a simple walk, a simple yoga, any kind of exercise which does not stress you, which is soothing for you, is advisable. It can be anything. Some people just simply shut off all their diets, stop eating, minimize their eating, but they don't think that when you stop eating and when you minimize your diet so grossly, you actually land up into nutritional deficiencies, which might affect you in different fashion. So, after a well-balanced diet, any kind of exercise which is comfortable for you, which does not put stress on your mind, and please never exercise with just this caution in mind that I want to lose weight. No, you are exercising over here to evolve the overall fitness of your body, which also involves controlling the weight. Another most important thing which I want to tell to all the females, mostly, it also applies for the male partner, please cut down on your coffee intake. 1 cup of coffee or 2 cups of coffee or any caffeinated drinks in a day will grossly affect the sperm count and the quality. That is why whenever we plan pregnancies for people, we also tell them that please minimize your coffee intake. Another important thing is, very important, which people don't analyze. You are planning a pregnancy and people are fond of using these lubricant jellies while planning a baby. Mind you, when you use these lubricants, it irritates the sperm. It indirectly does not allow the sperm to perform. A low motile sperm might get stuck up into these lubricants and not make its way forward up to the tube where the egg is lying. So this is a very important word which I wanted to tell you, that please don't use lubricants, avoid them while you are planning a baby. Another thing, if you are into an occupation which involves use of toxins like chemicals, there are people who are chemical engineers, they evolve around furnaces, and the body temperature is most of the time hot, or there are certain people who are involved into a lot of pesticide handling. Please, if you are having issues with childbearing, go and get your semen analysis done. I would also recommend a male partner to get a semen analysis done every 6 months, so that the male partner would always know about the health of the sperm and act accordingly. We should not wait for 2-3 years that if the child is not happening, then we are supposed to visit a fertility specialist. The basic simple test which you can do to understand the overall health of your sperm is a semen analysis, and it starts from there. So if you are handling toxins, there is a lot of pesticides, please take care of yourself. You have to be away from these toxins and minimize the exposure to yourself. Another thing which I want to tell you is that if there is difficulty in childbearing, please discuss about your medications with your doctor. There are people on certain drugs, like there are a lot of males who are on diabetic drugs, a lot of females who are on diabetic drugs. There is early onset hypertension in some male and females. There are male and females these days who are taking antidepressants from a very early age. And also one more thing which I would like to tell you is that menopause. Always for a female partner, you should always know that what is the history of menopause which runs in your family. By that I mean that what time did your mother have a menopause, or is there any history of cancers in the family, your sister or your mosi or your dadi, there were any kind of uterine cancers or ovarian cancers. So you should be on a high alert when such genetic histories are present in the family, and whenever you meet your doctor, you are supposed to inform your doctor that such a history is that, because whenever there is a history of early menopause in the family, then the genetic history goes forward, and the girls who are planning their childbearing may also land up into having an early menopause. It is at that time that we diagnose them with something which is called as a premature ovarian failure. So there are girls who come to me at the age of 25, 27, 30. There are doctors whom I have seen that because of the stress of life and because of some family histories which were there in their family, and they have history of cancers and premature ovarian failures, by the time they come to us, they simply have got no eggs which are remaining inside. And so we at Miracles Healthcare at Sector 14, I am also there at Sector 82. We would like to meet you whenever you have a problem, and we will definitely make you understand that how you have to go forward and plan your childbearing. So next I would like to discuss certain things with you. It's for male and female both. See, for males, there is no timing. As I told you, that it is just as simple as that the males produce semen every 120 days. But for females, because we are born with fixed number of eggs and these eggs are getting depleted very soon, we have to get the timing right. Every female ovulates once in 30 days, which is like that one day is very special for all of us. So you have to meet your doctor and understand the length of your cycle. You have to also meet your doctor and ask her as how can I get the timing right when we are planning a baby. There are certain simple methods which are available for people. There are ovulation kits. You can get an ultrasound done. You can discuss the length of the cycle with us and we can tell you as to what time you can perform and you are supposed to ovulate, or you can visit us at 9th or 10th day of your cycle. We can see your follicle and we can plan things forward from there. So this is what I mean to say is that you have to get the timing right, and it especially applies for a female that because we ovulate once in a month, we have to understand that we have to take care of that ovulation and plan the childbearing and plan the intercourse accordingly if we want an early childbearing. As I discussed earlier, that most of the time there is no problem in men and women, and it is just that the timing is going wrong, or it is just that the female is so stressed that the couple is not able to perform an intercourse because they feel that we just have to do it for childbearing. No, please don't take stress, and we will be able to help you to do things smoothly and in a streamlined fashion. Every woman's ovulation and every woman's menstrual cycle is different. So, every woman does not ovulate around day 13 or 14 of the menstrual cycle. Yes, maximum amount of females ovulate between day 14 to 15 or 16 of the menstrual cycle. But when there is a lengthy menstrual cycle, by lengthy I mean that it is more than 35 days, or when the menstrual cycle is on the lower side, that is less than 25 days, it is that time that the ovulation times have changed. And then you have to visit your doctor and understand as to when can you exactly plan a childbearing, in that what is the exact time of the cycle when the intercourse should be performed and the planning should be done. One more thing I would like to tell you. There are always males who come to us and who tell us that ma'am, nothing is wrong with me and it is all her problem, and you please tell her that things are wrong at her end. So I always tell males that there is an evaluation which is available at both the ends, and that evaluation decides as to what should be the plan of treatment, what should be the way forward. So I want to tell you that what are the reasons which cause difficulties in males, what are the reasons which cause difficulty in females. There are numerous amount of reasons. I would like to mention just a few which would be easy for you to understand that how can we plan and how can we decide that yes, we have a problem and we need to visit a doctor. Let's start with females. The most simple and the problem which is there in India these days is the tubal blocks. India has been a leading country in tuberculosis. We have been able to control it, but still now in the lower sector, people don't even know that they are suffering from tuberculosis. They just come and visit us and they tell us that ma'am, I don't feel hungry, I've lost a lot of weight, we are planning babies for last 2-3 years, but then we are not able to conceive. And these are like young girls. Recently we got a patient and she was 24 years of age, and she had just come to me that ma'am, we are married for 2 years and we have not been able to get a child. Young couple, wife is 24, husband is 26. We evaluated her and then we came to know that there was a lot of fluid collection inside her abdomen. When we took her up for a surgery, for a laparoscopy, we saw that both her tubes were absolutely blocked. The fluid collection which was there in her abdomen was suggestive of early signs of tuberculosis, and that is how the husband was not ready to believe that yes, the lady can have tuberculosis at such an early stage. So the most important reason which can cause tubal blocks in a female or can spoil the pelvic health, the reproductive system, the normal functioning of the reproductive system of a female is tuberculosis. The second most important thing for a female is hormonal problems. There are females who get irregular menstrual cycles, and these irregular menstrual cycles can be because of thyroid problems, can be because of hormones like prolactin, which regulate the normal ovulation and the normal menstrual cycle. So when you come to us, we can actually check these hormones for you and tell you that there is a problem, and there is a simple solution to these problems. We just medicate you, and then you have normal menstrual cycles and you start ovulating regularly. One more important thing which we have seen in females is the egg reserve. So you need to understand, when you are not able to conceive for 2-3 years, then what has been your egg reserve. There are very simple blood tests which we can do, and we can evaluate you on the ultrasound on day 2 or 3 of the menstrual cycle to understand that whether you are a person with a normal egg reserve or you are a person with a borderline egg reserve or a low egg reserve. If you are a person, it is not necessary that if you are a person of 25 or 28 years and you can't have a normal egg reserve or you can't have a low egg reserve. If you have a low egg reserve, it is an alert for you and your doctor that you have to go on the lines of aggressive fertility treatment. By aggressive fertility treatment, I mean that you have to either think on the lines of IUI or you have to either think on the lines of IVF. Because if your eggs are depleting so fast, then in that case we don't have much time to wait, and we cannot tell you to 6 months or 7 months or 1 year to have a normal intercourse and then plan your baby, because by the time you come back to us, your eggs might have been completely finished. Another important reason which these days I feel I'm seeing a lot of patients with that problem is endometriosis. In my earlier talks, I had spoken to you about endometriosis as to what endometriosis is. In a short thing, I would like to explain you that endometriosis is the females who are affected or females who have this endometrial tissue. Apart from the uterus, the endometrial deposits are present in all other parts of the reproductive system. And whenever a woman bleeds every month, these endometrial deposits also start bleeding. And in turn, they lead to a problem which is called as endometriosis. Now these endometriotic deposits and this endometriosis causes tubal blocks, it causes adhesions, all the organs and everything is stuck to each other inside, and also there is affecting the quality of the egg, the numbers of the eggs. The simple symptom which this endometriosis gives to a female is that they have pain abdomen while during your menstrual cycle, or they feel very low during the menstrual cycle, they have low backaches, they have pain in calf muscles, they have pain while intercourse, when they perform an intercourse after the menstrual cycle. So with such simple symptoms, no female would ever be able to understand that there is a problem inside and which is somewhere deep down like endometriosis. In that case, if you have a problem, then you can see us and we will make you understand, or we will evaluate you, and then we can take it forward from there. Similarly, some females come to us with the diagnosis of adenomyosis. Now these are all the reasons for a female factor infertility. The reasons are many more. There can be fibroids in your uterus which are not allowing the normal functioning of the uterus and the ovaries so that there should be a normal conception. Next, I would like to come to the male factor infertility. As I said earlier, it is very simple that a male can evaluate himself through a simple semen analysis. If there is any problem in the semen analysis, the male can visit us and we can tell the male as to what are the next set of tests which can be done. Most of the times, at a very young age, it is seen these days that men are coming to us with azoospermia. Azoospermia means that the male does not have any sperm. I have seen couples going into a state of shock and they land up into a very bad situation. Yes, indeed it is very difficult that initially we are not able to get a child, and later on when this diagnosis of azoospermia or having very low sperm count comes in the front of a female, in the front of a male, then the couple really gets very sad about it. So there are ways and means, there are medications, there are ultrasounds. You have to take a urologist opinion to understand as to whether these sperms can be regenerated or not. And this can only be done once we understand that what was the cause that these sperms have gone so down, or what is the cause that these sperms are not able to generate. Many a time the sperms cannot be generated because of simple blockages which can be opened by a urologist. Many of the time the sperms are not generated because there is some infections in and around the testes, and which can even be sorted out with a simple antibiotic course. Many of the time the sperms are not generated due to history of trauma in the early childhood, history of chickenpox in the early childhood, and the male partner is not even aware as to this is happening because of that. So when you come to us, and then we can evaluate you and we can decide that how to manage it. So some simple basic tests when we do for you. There is somebody who is asking me that how do you detect infertility? So the simple way to detect infertility is that when you are married for 1 or 2 years, and these 1 or 2 years have been years with unprotected intercourse, that means you have not used any protection while performing intercourse, and still you are not able to bear a child, it is at that time that you fall into the category of having fertility issues. Then you have to see your doctor for the evaluation of both the partners at a time. It is very important for us to understand that having a childbearing is not only at one end. Neither it is a male issue only, and neither it is a female issue only. The evaluation have to be from both the partners, and then only we can know that what kind of treatment we can plan further and where is the issue. I was discussing with you about the sperms. So in my earlier talk, I also told you that you have to have lifestyle changes. There have to be changes in your weight. There have to be changes in your habits of smoking and alcohol. On the other hand, one thing is very important which I see these days is that as a couple, as a unit, you have to give time to each other. I have seen males and females working the whole day long. The life is very stressful, and after COVID, definitely things are very stressful for all of us. But when we are planning a childbearing, which is the most beautiful thing in our lives, we should give time to each other. Most of the times, it is very easy to sort out the issues when you talk with each other and discuss, and then you can also visit your doctor and make them understand as to where the problem is. There are male partners who have issues that they travel. They cannot be there with their wives all the time when the female is about to ovulate. Don't worry, there are solutions to it. So the solution is that if your semen count is absolutely normal, there is no problem with your semen analysis, we can always plan an IUI for your female partner, and you just have to freeze your semen sample with us, and then we can put or we can insert the semen sample in the female partner even if you are not available. Obviously, we would take prior consents from you that during your unavailability, we can carry on with the fertility procedure. I hope you all know what is IUI, what is IVF. IUI is a very simple procedure wherein we take the semen of a male partner and we process it in the IVF lab. By processing, I mean that we try to remove all the debris from the semen. We try to remove all the bad sperms as much as possible. Obviously 100% cannot be removed, and then we prepare a very good concentrate of a good semen, and we insert it inside the uterus of the female partner, very close to the fallopian tube. So obviously, if you don't want to waste your time, you are traveling and you are not available for your partner, you can always freeze your semen samples. We can process it and then we can put it inside the female partner around the day of her ovulation. So that would help you in not wasting your time and planning your fertility properly. Obviously, we are doing IVFs, but IVF is only recommended for couples when there is an absolute indication that yes, we have to do IVF, and there is by no means the childbearing can be planned naturally or through the means of IUI. IVF is done when women are there with tubal blocks. IVF is done when you have very low number of eggs. IVF is done when the sperm counts are very, very, very minimal and there is a damage to the quality and the morphology of the sperm, and we know this with a simple semen analysis. IVF is done with advanced age people when we don't have really got time to plan a normal childbearing, or we have to there is a problem with the egg reserve. So there are multiple reasons when we take it for IVF. So here I would like to end my discussion, and I would like all of you to rethink and reconsider and do not waste time, and take it easily, discuss it amongst each other, and then go and meet your fertility expert. Thank you so much.